I was asked to talk about lessons learned from a Consumer Driven Health Cooperative, and my focus is on consumer participation, and so we've heard some references to that through the day. I'll spend a little bit more time on that. First of all, who are we? We cover 672,000 lives, and so we heard in the reference in the intro that we were around about 100,000 less than that, and that speaks to the tremendous growth that we've actually had recently. We have about 1,000 Group Health Permanente physicians, plus a network of around 9,000 providers. We have 10,000 employees, and we have 26 medical centers across the state. And the picture there, which I'm very proud of, is our new Bellevue Specialty Center, and so that's one of our newest facilities. Our mission at Group Health, we are a consumer-governed organization whose mission is to design, finance, and deliver high-quality health care. So I'm sure, as most of you can also relate to, we are a social and a mission-oriented organization. But if you do not have a mission, if you do not have a margin. And so keeping that in mind. We have a board of trustees. We are run by our members, so you have to actually be a member of the organization to participate on our board. We can't cherry pick anybody throughout the state. But we have a fantastic board: CFO, physicians, nursing executive, human resources executive, current and former consultants and business owners, retired economist, 2 attorneys, and community leaders. I'm not going to go through all of this, so don't worry. This is our governance and consumer participation model. What I will look at, though, is I've highlighted the Standing Nominating Committee. We have an independent body that we do not have trustees on that. We do not have executives on there. Their sole job is to vet trustee applicants who are coming into our system and forward to the membership those that they feel are most qualified to lead the organization. Some of the things that we're doing now, we actually have hired McKinsey consultants to come in and look at our governance model and provide us with feedback, because we are evolving. And as the organization grows, we're at about $3.5 billion company. Our strategic plan calls for us to be a $5 billion company in 5 years. So again, the growth that we're looking at is really tremendous, and our governance model needs to evolve to meet that. And so we really do need a governance body who can govern a $5 billion enterprise. So what we're looking at is, as a board, we are terrific at meeting all of the fiduciary requirements. We have an incredible leadership team with our legal department who help us with that. What we're looking at, though, is developing to become a more strategic board to really push on management and help us, again, as we move towards that $5 billion company. Our voting membership, and so we heard a reference earlier to it's pretty hard to get people engaged if all they're doing is voting on the board, and I agree with that. It is pretty difficult to do that. With the size of our company, we have 40,000 voting members, which is not huge if you think about the size of our company. But getting people involved and getting them voting is a challenge. We know that when we started in 1947, people really felt like it was their civic duty to participate and to get engaged, and that is terrific. But our active members who started the organization are literally dying off. And so when you look at our voting membership of the 40,000, I actually looked at the data right before I left because I thought, wouldn't it be interesting to know? But of those people that are 90 years old and above, as far as voting members, we have 1,700. And so what that also tells you is we do a great job of keeping people healthy. So I'm proud of that. But it also points out that we really need to do a better job and a good job of reaching out to people in different generations. And so we are looking at generations who want to be involved differently. I was really interested in the last presentation because it sounds like they're doing a good job of reaching different demographics. We're looking at the boomers, which, you know, the huge wave is coming in. How do we get them involved in our system? The X generations, who are really focused on their families at this point. The millennials, who are doing the, tweeting everybody and everything else with the social media. And we're just dabbling in that. And so we're really looking at how do we start to expand that. But the environment has changed significantly, and governance really has moved out of the reach of the average member. And so we have kept more of the governance function focused on the board. The members that we have, we're looking at engaging them and getting them to participate at different levels of the organization. but it's critical that they stay engaged. I mean, that is really important. And for our system, where we have both coverage and care, again, getting them involved and to have that, that connection is highly important. Some things we're thinking about. So like you, we know that we need consumer advocates. We know that. We also know that you can't just assume. You might have, Group Health Cooperative, but you can't assume that member involvement is just going to happen. It doesn't just happen. And so there's a push both to management to say this is really important, and a push to the membership to say this is really important in pulling people on. One example that I'll give, I know I have not very much time, but the shared decision making, which is very important. And so it's getting our consumers to partner with their medical team on their care. And so they are the center and the core of that care. So that we have shared decision-making tools where we're doing some pilot research right now that we're giving to patients, which helps to show them some of the options that are available. And the research supports the fact that when consumers are given the information, often the choices they make are for less interventions, which is better quality at a lower cost. So we're doing quite a lot in that area. Some of our active consumers are really pushing us on this and saying, hey, this is really important. So it's coming not just from management or the board, but coming from consumers who say, I need the information, I want the information. And we also know some things that we're thinking about. There is a line between governance and consumer participation and consumer involvement. So why does all of this matter? It matters for several reasons. One of them is that management is held accountable. When you have a membership organization, your management will make better decisions, but they know they're accountable. So they talk about how will our members respond to this at the annual meeting, for example. And that puts a different kind of heat on the table as if you were not accountable. We also know that patients need to be engaged in their own health care. And so we are doing a lot of work and some innovations around that because they really are the heart of this and can make it work. I mentioned that better decisions are made and that the patient-centered care is the core of our organization.